As a medical student, I was taught that metformin is a medication that is effective for patients who are suffering from diabetes mellitus type 2. It is also effective for insulin resistance in patients who are suffering from PCOS or obesity. However, when I read this book called Lifespan by Dr. David Sinclair, it mentions an experiment involving mice and metformin, in which it was seen that the drug metformin had improved the health outcomes of the mice, increasing their lifespan. This caught my attention. So metformin isn't just a sugar-controlling pill. Its benefits are being explored in cancer prevention, for management of weight loss, as well as patients who are suffering from chronic symptoms of COVID. In fact, it's the second most prescribed drug in USA, and the World Health Organization has labeled this drug as an essential drug. So how did this inexpensive, decades-old drug suddenly become a star in modern medicine? I'm Dr. Divya Datta, and you're watching Health Breaking News. Today, we're taking a deep dive where we'll learn what is metformin, who is it for, what are the risks, and is it worth the hype? Metformin belongs to a class of drugs which are known as biguanides, and its roots trace back to a plant which is known as French lilac. It works by decreasing the production of glucose in your liver, by reducing the absorption of glucose in your intestines, and by improving insulin sensitivity in your muscles. Primarily, metformin is prescribed for patients who are suffering from type 2 diabetes mellitus, but doctors also prescribe this drug for PCOS. Metformin improves ovulation, decreases androgen levels, and helps regulate menstrual cycles. Pre-diabetes. It helps delay the onset of diabetes in high-risk patients. Obesity and insulin resistance, in which patients who are suffering from metabolic syndrome may benefit from this drug. This drug is also prescribed for patients who are suffering from gestational diabetes, that is diabetes when you are pregnant, in certain cases in which it's not controlled by diet and lifestyle modifications. But lately, this drug is heavily researched for anti-aging, cognitive decline prevention, for cardiovascular protection, and it is also considered as a potential drug that can benefit cancer patients. Now let's talk about one of the most highly Googled questions. Can metformin help in reducing weight even if you're not diabetic? The answer is yes, but modestly. On average, patients lose about 2 to 5 kilograms, but it also depends on your lifestyle modification, diet, and dosage. It works by suppressing your appetite, by increasing a hormone known as GLP-1. It also alters the bacteria which is present in your gut, beneficial for you. It reduces the storage of fat and reduces insulin levels. So it's not a magic pill. Its effects take time, but this drug is beneficial for patients who are suffering from insulin resistance, as well as those who are trying to lose weight but are unable to do so through diet alone. Now here's where this drug gets exciting as well as controversial. In mice and other animal models, metformin has been shown to increase their lifespan. This drug activates a special sensor which is present on your cells, which is known as AMPK. This improves the function of your mitochondria, reduces inflammation, and hence, your cell lives for a longer time. Human studies are still ongoing. A tame trial targeting aging with metformin is a project which is heavily focusing on these effects of metformin. So this doesn't mean that metformin will make you live up to 150 years, but it can prevent diseases such as cancers, Alzheimer's, certain cardiac disorders. Metformin is also being studied for other conditions such as for cognitive decline. Some studies suggest that metformin may reduce the occurrence of dementia in patients with metabolic syndrome. Early research suggests that metformin can slow down the growth of tumors, especially in cancers related to insulin resistance, such as breast, prostate, and colon cancer. A recent study published in The Lancet showed that administering metformin in early cases of long COVID reduced the symptoms, especially in overweight individuals, by about 40%. Again, these are early research findings, and this drug isn't prescribed for these uses. However, science is still growing. The side effects of metformin include nausea, diarrhea, and abdominal pain, but these side effects can be reduced if you take metformin with food or you take an extended release version of the drug. Long-term use of this drug can lead to vitamin B12 deficiency, for which doctors prescribe an annual checkup for your blood. It can also lead to lactic acidosis in patients who are suffering from any kidney disease, liver impairment, or heart failure, for which a kidney function test is done before prescribing this drug. So how does metformin compare with other drugs that are trending, such as Ozempic and Berberine? First of all, Ozempic is a brand. Its active ingredient is semaglutide, which helps in activating a receptor known as GLP-1 and helps in greater weight loss. However, it is given through injections, which are expensive, and it comes with its own side effects. Berberine is a natural ingredient which is found in plants such as barberry. It is useful for lowering the levels of glucose in your blood, similar to metformin. However, its studies aren't well regulated. So metformin sits in the middle. It's affordable, proven, and versatile. However, its effects are less compared to other GLP-1 agonists. So is metformin a miracle drug? I'd say metformin isn't a miracle drug, but it's definitely an underappreciated tool in modern medicine. It's affordable, well-studied, and multi-purpose. If you're considering to take this drug for weight loss, PCOS, or longevity, I suggest you consult a doctor first. I hope this video gave you a clear picture of why metformin is making the headlines again and why it's worth paying attention to. Let me know in the comments. Do you take metformin? Are you considering to take metformin for purposes other than diabetes? And don't forget to like, subscribe, and check my other videos. I'm Divya Datta, and you're watching Health Breaking News.